Hello everyone. Today we will be learning about the elbow joint. Elbow complex includes the humeroradial joint and humeroulnar joint. These two are hinge variety of joint. Then the proximal and distal radioulnar joint is known as a cubital articulation. Major function is to provide the mobility for hand in a space by shortening and lengthening the upper extremity. You will see the articulation of the joint in the diagram. Now the humeroulnar and humeroradial joint. Joint structure, the type is compound joint that functions as a modified or loose hinge joint. Movement occur in sagittal plane around the coronal axis, that is flexion and extension, that is only movement occur at the elbow joint. Articulating surfaces for humeroulnar articulation, that is trochlear notch of ulna and olecranon fossa of humerus. You'll see in the diagram the trochlear notch of ulna and the two condyles of humerus, lateral and medial. Then humeroradial articulation, convex capitulum of humerus over the concave radial head. Attachments of the elbow joint. First is joint capsule. All the joints are enclosed in a single joint capsule. Next, the ligaments. First is medial collateral ligament, that is ulnar ligament. It is thick triangular band at a medial aspect of elbow. It limits the extension in end range of motion. Next is lateral collateral ligament complex. It consists of lateral collateral ligament, lateral ulnar collateral ligament, and annular ligament. It is responsible for stabilizing elbow against the varus torque. Next important topic in elbow joint is carrying angle. It can be asked for 3 marks. So the carrying angle is long axis of the humerus and forearm from an acute angle medially when they meet at the elbow. It also known as cubital valgus. Normal values in male full elbow extension 5 degree, in female 10 to 15 degree. This angle is slightly greater in a woman because of the wider pelvis, so that the hand clearance during the walking is facilitated. The carrying angle disappears when the forearm is pronated and elbow is in full extension, and when forearm is supinated and elbow is in full flexion. Clinical abnormalities. An increase in angle beyond 15 degrees is abnormal and is termed as cubitus valgus, whereas decrease in angulation below 5 degree is termed as cubitus varus. If angulation is due to injury, it is termed as gunstock deformity. Next is osteokinematics. It is a branch of biomechanics which deals with the rotatory movement. Movement is flexion and extension. Plane occurs as a sagittal and coronal. Range of motion is 135 to 145 degree. Next is arthrokinematics. Movement is flexion. Roll and glide is anteriorly, and extension, roll and glide is posteriorly. You will see in the diagram, while doing the flexion, it rolls and glide in the same direction, that is anteriorly, and while doing extension, it rolls and glides posteriorly. Next is kinetics, that is muscles which help while doing the movement. First is flexor group of muscle, first brachial and biceps brachii. Both are mobility muscles which helps while doing the movement. Then come brachioradialis. It is inserted at a distance from the joint axis. The largest the component of muscle force goes towards the compression of the joint surface and towards the stability. You will see in the diagram the flexor aspect of muscles which helps in the movement, that is bicep brachii, long head and short head, brachialis and brachioradialis. Now we will see the extensor group of muscle, that is tricep brachii. Long head of triceps is affected by shoulder position as it is a two joint muscles. Long head of triceps brachii has the ability to produce a torque may diminished when full elbow extension is attempted with the shoulder in hyperextension, that is active insufficiency, and medial head is active in unregistered elbow extension. Maximum isometric torque is generated at the position of 90-degree elbow flexion. Next muscle is anconeus. It assists in elbow extension and apparently also acts as a stabilizer during pronation and supination. Next is superior and inferior radioulnar joint. It is diatrial uniaxial joint as a pivot type. It allows 1 degree of freedom, that is pronation and supination, in transverse plane. They both are linked together and functions as a one joint. Articulating surfaces are superior radioulnar and inferior radioulnar, that is ulnar head with the ulnar notch on a radius. Movement. First is pronation. Range of motion is 0 to 80 degree. Radius crosses over the ulna. And then is supination. Range of motion is same, 0 to 80 degree. that is radius and ulna lie parallel to one another. So this is all about the elbow joint. It can be asked for 7 and 3 marks only, and rarely asked for 15 marks in university, but prepare according to this. So I have covered like for 15 marks answer only. If you find any difficulty understanding, then please let me know in the comment section, and thank you for watching. And if you like the video, then please like, share and subscribe to it.